All right, this is your medical assessment station. This is my patient, so I'm going to go ahead and make sure my BSI on and my scene is safe. What's my dispatch information?
You are dispatched to a 65-year-old female complaining of an unknown medical. Neighbor has reached us.
Okay, so this is going to be a nature of illness call. It doesn't look like it's going to be a trauma. We're going to approach the house. Notice that we have one patient. Because this is an altered mental status patient, we will request additional EMS backup. And then I don't see any indications that the patient has fallen, so we do not need to do anything with the C-spine right now, although we would have considered it. My general impression of the patient is that she's sitting upright, her skin looks clammy, she does look agitated, and I'm going to now determine the responsiveness level of my patient. So, hi, I'm Christine, I'm with EMS, how are you?
I'm good.
Good, can you tell me your name?
Jesse,
Jesse. Alright, and can you tell me where you live, Jesse?
Yorkshire Street,
Yorkshire Street, okay, and can you tell me what year it is?
2010.
2010. Okay, so she is alert to person and place, but not alert to time because it is 2014. So right now we're going to determine our chief complainant, and as of right now I don't see any apparent life threats. So we're going to go ahead and assess what the problem is. Why'd you call EMS today?
I don't know, my neighbor called you. She said I was acting funny.
Okay, and do you feel funny?
Maybe a little.
Maybe a little. Okay, so our chief complaint again is going to be the altered mental status. We're going to go ahead and move on to assessing our airway and breathing. So we're going to check and make sure that she has adequate ventilation by assuring appropriate chest rise and fall and watching her ventilations. And then we're going to initiate the appropriate oxygen therapy. So she seems to be breathing a little bit fast right now, so we're going to go ahead and put her on 12 liters of oxygen via a non-rebreather mask. Go ahead and put this on right here.
What's it gonna do for me?
This is going to make you feel so much better if you just breathe right into there, okay?
Okay.
Alright, so then we're going to go ahead and we're going to continue assessing circulation. So we're going to first see if there's any major bleeding, do we see any major bleeding at this point?
You do not.
Okay, and then we're going to go ahead and check pulses.
Pulses are present.
Pulses are present, okay, and then we're going to go ahead and take off her shoes and check her pedal pulses.
Pedal pulses are present.
Alright, and then the last thing we're going to check is we're going to make sure that we're going to check her skin color, temperature, and condition.
Her skin is pale, cool, and diaphoretic.
Okay, so based on those signs and her chief complaint, this is a priority patient. We're going to go ahead and make this a load and go. We're going to get her in the ambulance and continue our assessment from there. Ma'am, can you tell me about how long ago that you started feeling funny?
I'm not quite sure. Sometime today.
Okay, have you tried anything to make it go away, or have you tried anything that makes it worse?
Yeah, nothing seems to make it go away. It just keeps getting worse.
It just keeps getting worse? Okay, and then can you tell me from a scale of 1 to 10, 1 being not confused at all, 10 being the most confused you've ever been before, what would this be?
6 or 7.
6 or 7, okay. And then can you describe the confusion to me? How does it feel?
It's hazy. It's just.
It's hazy.
It's like a fog.
Okay, all right. So we're going to go ahead and continue on to our sample history at this point. Do you have any allergies?
I'm allergic to sulfa.
Sulfa, okay. And then are you currently taking any medications for anything, including birth control?
Yeah, I take a couple. I take an aspirin on a daily basis because I read somewhere in a magazine it's supposed to be really good for you.
Okay.
And I take this, oh God, it's in my kitchen. I have to take it every day, and I have to do all these tests for it. And insulin.
Insulin? Okay, so you're a diabetic?
Yeah, is that the name for it?
Okay.
I don't know. The doctor told me I had some disease.
Okay. When was the last time you had anything to eat or drink?
Honestly, I'm not sure. I think it was last night when I went to bed.
You're not sure? Okay. And do you have their past medical history that we might need to know about?
Yeah, I've had a couple of surgeries, and the doctor says I got a weak heart, but that's the stuff I have to take medication for daily.
Okay. All right. So then we're going to go ahead and reassess. So this would be a neuro reassessment. So we're going to assess that this patient is probably suffering from hypoglycemia. So we're going to administer a full tube of oral glucose. Before we do that, we're going to check her blood glucose to make sure that that's correct and get an appropriate set of vitals. So we're going to check her blood glucose. First, ma'am, have you ever used one of these before?
Mine looks something like that.
Okay, well, you know the drill, then we're just gonna go ahead and prick your finger real quick.
Yep.
All right, and then we're gonna have this monitor read it, and we're gonna see if that's what's going on today, okay?
Okay.
All right, I'm gonna go ahead and swab this with alcohol, and then go ahead and prick your finger here. Feel poke on 3, ready? 1, 2, 3. All right, so we're gonna go ahead and get some blood going here for you. And we'll get that in here. All right.
Your blood glucose level is 32.
Okay, so if you just wouldn't mind holding that onto your finger for now. So our blood glucose level is 32, which means she is, in fact, having hypoglycemia. We're going to go ahead and get a blood pressure, a pulse, and then we're going to check her respiratory rate and quality before we give her that oral glucose.
Your blood pressure is 116/76.
Okay. And what's my pulse and my respiratory rate?
Pulse is 96. Respers are 24 non-labored.
Okay, so those are consistent with being able to give oral glucose. We're going to go ahead and put that glucose on a tongue dispenser and administer the entire tube. Have my patient swallow it. Does my patient accept the oral glucose?
She does.
Okay. And so then we're going to wait about 5 minutes and we're going to reassess the affected system. So we're going to see if that improves her mental status at all. We're also going to double check and see if the oxygen is helping. And my field impression of the patient, does she seem to be improving?
She does.
Okay, so my patient seems to be improving at this point. We are en route to hospital. So we're going to reassess our patient every 5 minutes because she is a priority patient, and reassess vitals all the way to the hospital. And upon arriving at the hospital, we're going to provide an accurate verbal report to the arriving unit, and then go ahead and transfer her to a higher level of care.
Anything you would have added, subtracted, or done differently?
I don't believe so.